Dementia is a neurological condition that affects millions of people worldwide. It is a progressive disease that causes a decline in cognitive function, including memory loss, difficulty with language, and problems with decision-making. Dementia impacts not only the individual but also their family and caregivers. As the population ages, the prevalence of dementia is expected to increase, making it a significant public health concern. This article will provide an overview of dementia, including its types, causes, symptoms, and available treatments. We will also discuss coping strategies for those with dementia and their caregivers, and the stigma surrounding this condition. Living with dementia can be a difficult and confusing experience for both individuals and their loved ones. With the prevalence of dementia increasing worldwide, it is important to understand what it is, how it affects people, and how it can be managed. What is dementia? Dementia is a broad term used to describe a decline in cognitive function. It can impact memory, communication, thinking, and the ability to perform daily activities. Dementia is not a normal part of aging, but it is more common among older adults. The condition can be caused by a variety of underlying issues such as diseases, injuries, or medications. The prevalence of dementia. According to the World Health Organization, WHO, there are around 50 million people living with dementia worldwide, and this number is expected to triple by 2050. In the United States alone, there are approximately 5.5 million people with Alzheimer's disease, the most common type of dementia. The impact of dementia on individuals and society. The impact of dementia on individuals and society can be significant. For individuals, dementia can result in a loss of independence, difficulty communicating, and changes in personality and behavior. For society, there are also economic costs related to the care of those with dementia. It is important to recognize the challenges associated with dementia and work towards supporting affected individuals and their families. Types of dementia and their symptoms. There are several types of dementia, each with unique symptoms and causes. Here are some of the most common types. 1. Alzheimer's disease. Alzheimer's is the most common type of dementia, accounting for 60 to 80% of cases. Symptoms can include memory loss, difficulty completing familiar tasks, and challenges with language and communication. 2. Vascular dementia. Vascular dementia is caused by reduced blood flow to the brain and can result in problems with attention, planning, and decision-making. Symptoms can vary depending on the extent and location of the brain damage. 3. Lewy body dementia. Lewy body dementia can cause fluctuations in attention and alertness, as well as visual hallucinations and motor symptoms similar to Parkinson's disease. 4. Frontotemporal dementia. Frontotemporal dementia can cause personality changes, inappropriate social behavior, and problems with language. Symptoms may appear before memory loss. Common symptoms of dementia. In addition to the specific symptoms of each type of dementia, there are also some common symptoms, such as confusion, difficulty with daily tasks, mood changes, and personality changes. Causes and risk factors for dementia. While the exact cause of dementia is unknown, there are several factors that can increase the risk of developing the condition. 1. Age and genetics. The risk of developing dementia increases with age. Additionally, genetics can play a role in some types of dementia, such as Alzheimer's disease. 2. Lifestyle factors. Lifestyle factors such as a poor diet, lack of exercise, smoking, and excessive alcohol consumption can increase the risk of developing dementia. 3. Medical conditions. Certain medical conditions such as high blood pressure, diabetes, and high cholesterol can increase the risk of developing dementia. 4. Environmental factors. Exposure to toxins, head injuries, and infections may also contribute to the development of dementia. Diagnosis and treatment of dementia. Diagnosing and treating dementia is an ongoing process that involves managing symptoms and supporting affected individuals and their families. 1. Diagnosing dementia. Diagnosis of dementia involves assessing symptoms and ruling out other potential causes. This may involve cognitive tests, brain scans, and medical history. 2. Medications for dementia. There are several medications approved for the treatment of dementia, including medications to manage symptoms and slow the progression of the disease. 3. Non-drug therapies for dementia. Non-drug therapies such as cognitive stimulation therapy, art therapy, and music therapy may also be effective for managing symptoms and improving quality of life. 4. Caring for someone with dementia. Caring for someone with dementia can be challenging, but there are resources available to support caregivers and help them provide the best possible care for their loved ones. This may include support groups, respite care, and professional caregiving services. 5. Coping strategies for those with dementia and caregivers. Dementia can be a difficult condition to manage, both for those living with it and their caregivers. However, there are strategies that can be used to make life easier. Here are some coping strategies for those with dementia and their caregivers. 5.1. Adapting to life with dementia. For those with dementia, adapting to a new way of life can be tough. But it's essential to adjust and find new ways to overcome daily obstacles. One way is to establish a routine for daily tasks such as eating, bathing, and exercise. Another strategy is to simplify the tasks and break them down into smaller steps. Additionally, using assistive technology, such as a pill dispenser or GPS tracker, can make life easier and enhance independence. 5.2. Support services for caregivers. Caregivers of those with dementia often experience a high level of stress. Therefore, it's vital to access support services such as counseling, respite care, and caregiver support groups. In addition, local organizations and charities provide various services, including transportation, meal delivery, and volunteer companionship. 1. Self-care for caregivers. Caregivers sometimes forget to take care of themselves when caring for someone else. However, the stress of caregiving can take a significant toll on an individual's physical and mental health, increasing the risk of burnout. Caregivers must make time for themselves, prioritize sleep, maintain a healthy diet, engage in physical activity, and find activities that bring them joy and relaxation. Dementia research and future developments. Dementia is a growing concern globally, and there is ongoing research to better understand the condition and identify new treatments. Here are some current and future developments in dementia research. 1. Current research on dementia. Current research is looking into the risk factors that contribute to the development of dementia, including genetics, lifestyle, and environmental factors. Additionally, researchers are exploring new ways to diagnose dementia earlier and studying the effects of exercise, cognitive training, and social engagement on brain health. 2. Potential future treatments for dementia. New treatments for dementia are on the horizon, some of which are currently undergoing clinical trials. These treatments include immunotherapy, which aims to remove proteins that cause Alzheimer's disease, and gene therapy, which aims to reduce the genetic risk of developing dementia. Stigma and misconceptions surrounding dementia. Dementia is still a highly stigmatized condition, despite its prevalence worldwide. The lack of understanding and knowledge of the condition gives rise to misconceptions that need to be challenged. Here are some of the misconceptions surrounding dementia. 1. The impact of stigma and misconceptions on people with dementia. Stigma and misconceptions can be highly detrimental to those living with dementia. Fear of discrimination can prevent individuals from seeking a diagnosis, leading to delayed treatment and a decline in health. Additionally, stigma can lead to social isolation, depression, and anxiety, making the condition even more challenging to manage. 2. Challenging stigma and misconceptions about dementia. To challenge the stigma surrounding dementia, it is essential to raise awareness and promote education about the condition. This can be done by highlighting the experiences of those living with dementia, emphasizing the importance of early diagnosis, and creating supportive communities. Additionally, People should avoid using language that reinforces negative stereotypes and promote a dementia-friendly society. In conclusion, dementia is a complex condition that requires specialized care and attention. While there is currently no cure for dementia, there are strategies that can help manage symptoms and improve quality of life for those affected by the disease. By raising awareness of dementia and challenging stigma, we can create a more inclusive and supportive society for people living with this condition. With ongoing research and development of new treatments, there is hope for a future where dementia can be better understood and managed.